TNT Open Mind Insights brings you powerful, authentic conversations, illuminating the path to better mental health care for all.
Hi, Dr. Rimal Bera. I'm
Yeah.
super excited to meet with you today and just explore what you know about mental health and some of the solutions out there. Thanks so much for joining us.
All right, so happy to be here. Yes, I'm a psychiatrist. I've been in practice for 35 years um, and always worked in the academic setting. I'm a full-time faculty at the University of California, Irvine. Uh, I also did my psychiatry training here at Irvine. And, over the years, I've been involved in, many different aspects of mental health care, but primarily adults with chronic mental illness. That's really been the focus of the area that I worked in.
Amazing. Well,
Mhm.
one of my specialties as a video production person
Okay.
is mental health. That's my
Okay.
passion because
Yeah.
I actually don't think that there's anybody whose life is not touched by um, mental health challenges,
Mm.
essentially, So life is hard.
Yes.
Things happen, and
Yeah.
then there's predispositions to illnesses and whatnot. So what you're doing is so important, and I really applaud you for that.
Yeah. Thank
Yeah.
you.
Yeah. So
Yeah.
first, I'm really curious to know more about how you became interested in this particular topic enough to dedicate 35 years of your
Right.
life to it.
Yeah. I've been asked that question, over the years, and I try to think of, different responses, that it doesn't just seem like it's the same response. And it always makes me reflect on, why did I choose, mental illness and psychiatry. I knew I wanted to be a doctor from a very young age.
Oh.
As a Indian American, it's not uncommon. Parents, become a professional, and my parents thought, medicine to them, and if their children could achieve medicine was of importance to them. So I always like to really start at that point that I feel so thankful that my parents sort of supported and guided, toward, a medical doctor as a career.
Mm.
I never would have thought mental health and psychiatry in particular. Uh, when I got into medical school in 1983, I would say psychiatry would have been the furthest. I
Mm.
thought of, a physician as somebody with a white coat, a stethoscope. You go into a hospital or a clinic, and somebody has a physical illness. Uh, and mental health and mental health care was very, very different in the 1980s.
For sure.
We were beginning to come forward. But it was during my third year rotation. Psychiatry is one of the core rotations when you're in medical school. You go through surgery, medicine, OBGYN, pediatrics, and psychiatry. Uh, and it happened to be psychiatry was my last rotation
Mm.
in my third year. So by then I was a little skilled. I wasn't afraid, okay, what do I do in the hospital? I'm just a medical. I felt, I got a white coat and I know how to take a notes. And so I had a little more confidence, but it was the actual rotations. Uh, I liked the other rotations and I did well in them, but to me, they seemed too like 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 what's the word, like rote. I'm thinking of it, and I'm blanking on the word, but they seem too routine and too
Mm.
mechanical.
Mm.
Like examine a patient, then think of the condition, run some labs, and yes, you have to be smart and you have to be, but it seemed where and that psychiatry rotation was more like an art and
Oh,
like get
interesting.
to know who the person
Yeah.
is, find out what their struggles are. And I was learning from these patients on my life also.
Oh,
Um,
interesting.
so that was a piece that seemed to resonate a little bit. I like the piece that it's a little bit of a puzzle, getting to understand the challenges that this individual has. There was a little bit more of an art to it. Um, and I also didn't see it as like there were acute emergencies. Like
Hmm.
somebody comes into the emergency room or somebody on the operating table. I mean, you have to be very certain because it's a life and death. I saw this as not quite a life and death. There was a little bit of trial and error. I could try this approach, it didn't work, then I could maybe go with it. So that was sort of the base. That there was something resonated during that. It's a short rotation, 8 weeks, and then there was a. It was broken up into two. Now that this is great, I'm starting to reflect on, why I wanted.
Yeah.
The other part was during that 8 weeks, we had to, so one was in an inpatient psychiatry unit, and then the other piece was in uh, a substance abuse center. And UC Irvine, where I went to medical school,
Oh, you went to middle schools
at, at,
there
at
too.
Irvine also.
Wow.
Yes, so I've
An
been here a long
alumni
time.
and a doctor
And a
here.
doctor, yeah.
Wow. That's so
But
cool.
they had just hired somebody that was uh, a substance abuse expert from the East Coast. If you remember around that time, Betty Ford, the wife of President Gerald Ford, she came out with her addiction
Hmm.
to alcohol and prescription medicines. And she felt that as clinicians, we had very little understanding. So she opened up the Betty Ford, and it started
Oh,
here in Orange
oh, okay.
before it moved
Mhm.
out to Palm Desert. And I was part of the third group that rotated there.
Hmm.
And again, Betty Ford, as the first lady, everybody knew her. So at this center, we had prominent um, entertainers and athletes come in who had substance abuse. And the doctor who ran this program felt that the way medical students will learn about substance abuse being a real disease, he assigned us to one person, and we spent 4 weeks from
Oh,
breakfast to
wow.
dinner just doing everything with that person. So, and
Huh. That's so
it was
interesting.
powerful to
Yeah.
hear how their defenses break down, on why, you know, they were abusing this substance or not. It was just, and then at the end, all the patients sort of got to know you. Oh, that's the medical student working with. And then there was a thing called the hot seat where we sat in the middle,
Hmm.
and all of the patients could then ask us anything, and you
Oh,
felt so
so it went
vulnerable.
both
I
ways.
mean, I
Oh
started
my
crying.
gosh.
Like here I am,
Wow.
22, 23 years old, and these are people that are in treatment talking about, well, I don't think that's really what you feel.
This is so
It was
interesting, huh?
fascinating.
Yeah.
And I said, I think this is right. I
Oh.
mean, it's called the hot seat. It was notorious at the end of the rotation. You were forewarned by your classmates. If you choose that, you're going to be in the hot seat. Hot seat, I can say, oh yeah, I'm a doctor and I want to do. No, it was they can read you. These other people in treatment could read right away what you're hiding or not.
That's so
It was
interesting. That must have taught you a lot
it did. I mean,
because that kind of removes that barrier of
yeah.
like I'm above
Oh
you
yeah.
sort of thing, which
No,
is
they were much more skilled in understanding human behavior
very,
than I am today because
whoa.
they had, they've lived it. Yeah.
Yeah. Yeah. So you seem like you're very just fascinated with human behavior
Yeah,
and
right,
psychology
right.
and
Yeah.
wanting to.
I think most people, even if you are an engineer, psychology is of interest, like why do humans
Not
tick?
everyone is interested
Not
in it.
interested,
No.
but they're interested in, psychology in high school is always the fun class, like, oh, that's what, why people are angry or not angry. I mean, we doesn't mean we have want anything part of it, but there's an interest in why humans
Yeah.
behave like they do.
Yeah. And so what has your specialty become?
Okay, so once I chose psychiatry, and then you apply, and I went to residency, a 4-year residency in psychiatry, uh, which was also at UC Irvine. At that time, the brain was just beginning to really come into its own. We were understanding, what part of the brain might not be functioning, fully with certain illnesses like schizophrenia,
Hmm.
depression, bipolar disorder. And we had brought a really top level team to UCI of faculty that were doing some great brain imaging and all, and it, that became of a lot of interest to me. And when I was a senior resident, they offered me an opportunity. Would you like to spend 1 year? Actually, we're looking at new medicines, and you could be sort of a junior faculty. So I felt, wow, they thought highly of me. I think it was just, but new medicines were coming forward. So then that led me into an opportunity to be hired on as a faculty, overseeing that research unit. So most of my career is, looking at new treatments for the chronic mental illnesses, primarily medications.
Wow, interesting.
Hmm.
And there's been, I mean, you've been in it for 35 years, and there's been huge changes and findings within 35 years.
There has.
And it seems like it's just picking up speed too,
Yes.
right?
Yeah.
Yeah.
I tell people that are thinking about psychiatry, and we're still just at the infancy of understanding the brain.
Ugh.
I mean, you may see on the news, oh, we understand this. We just, the other organs we understand well. The heart, the liver, the kidney, those are simple organs.
Yeah.
Certain cells, and how the brain it's the last frontier.
You're on the last frontier.
Yes.
That's
And
amazing.
we're, I don't know in whose lifetime we're going to get to that point of fully understanding, but the brain is we have an idea when it's not working properly, what might be behind that, and here's a treatment, but we have a long ways to go.
But isn't there something untangible too about the brain? I mean, we are talking about the soul a little bit here too. Maybe that can't be physical.
Absolutely.
Yeah.
Absolutely.
So it's
I mean,
very mysterious.
Yeah. In mental illnesses, like no two individuals that may have the same condition really have the same experiences, or
it's so complicated.
Yeah. Well, it's like
complex.
For the other organs, it's this treatment A for person A will work most likely for another individual.
Wow. Yeah. That's so interesting. And then I think you've probably also witnessed how mental health has shifted to becoming considered a piece of health, where it was kind of separate before, right?
Right.
And how is that important, or why is that important?
Well, I think it's in acceptance, from society that it's real. There is still, one of the challenges in mental health is stigma. I think there'll always be stigma, and as a long-term clinician, I can accept that there'll be stigma, because I don't even always understand, they're having symptoms, and I've gotten this good history and, collateral information from family and all, but, how much of it is their behavior? How much is it their upbringing? I still ask myself those questions. So imagine society saying, no, they can snap out of it.
Are there less people saying that now, would you say?
There's less, but I don't try to fight that.
Okay, that's interesting. That's an interesting viewpoint.
Because there's not a hard diagnostic tool. I can't just put a scan on your head and say, yep, you've got schizophrenia. It's clear because of this. Maybe one day I'll be able to.
Aren't there some blood tests out there?
There are blood tests, but diagnoses are still primarily based on getting the history and finding out where they are now, what has changed. Blood tests can maybe, but they're not as sensitive as we would like, and we want to be careful making diagnoses based on a blood test or brain scan.
Yeah, because maybe someone will, the blood test may say one thing, but the behavior is saying another.
Absolutely.
That could happen, I'm sure.
Yeah.
So what are some of the biggest challenges that you're witnessing in your field that we could talk about solutions to?
Yeah. Now that we've appreciated an illness like, let's say, we'll use schizophrenia as an example. It's a brain illness. I think we will accept that as society. And because it's a brain illness, one of the biggest challenges we have when, we decided that there may be a treatment, let's say a medication. We do feel medicines are a big piece, of getting a better outcome. because it's a brain illness, the inside judgment of that individual afflicted with the illness is not the same as somebody with a illness of another organ whose brain is intact. They may appreciate, if I don't take this treatment, X, Y, and Z may happen. But the person with the mental illness will not always have that appreciation, because the part of the brain that's impacted is involved with motivation, drive, uh, appreciating consequences. That's often impacted.
Yeah, it's all
So it makes
together.
sense. Somebody who gets better will stop taking the treatment. So that's a big challenge.
Yeah, I'm
Somebody
feeling
who's
better, I'll stop.
better,
Yeah.
yeah,
Okay.
and never really believing that they have an illness. That's
Mhm.
another big challenge.
Mhm.
Um, so I think we want to do our best with keeping somebody who gets better or well to stay well. And we,
What does that
yeah,
look like? What do you think that would involve?
yeah,
I don't know if this is
yeah,
true because I'm not a
right,
psychiatrist,
right,
but I feel like a reduction in stigma would help
yes,
keep people well because then they would be more accepting of the fact that they are on medication.
right, right.
Do you think so?
Absolutely. So
Yeah.
I think that comes back to your, I think, question, are we bringing mental health into the discussion of physical health? Absolutely. Uh, we, for future clinicians, not just medical doctors, but nurses, nurse practitioners, physician assistants, they're all getting more and more training in their professional schools about depression, anxiety, memory trouble, even dabbling into a little bit, the more what society might consider severe illnesses like schizophrenia. They're getting exposed to that earlier. So I think that helps.
I would
These are
think
not, it's
so.
not an unfamiliar term. Even on television,
Hmm.
I think the media, you might see a certain series or show that might talk about, you know, uh, these conditions a little bit
And
more.
the schools are
Yeah,
way more aware. I don't know if it's
yeah,
just a California thing, but I spent a lot of time doing work in the schools, and a
hmm,
lot of them now are having things like wellness centers
right,
where kids can go to, and like counselors at school.
right.
And um, kids are familiar with the idea of a mental health break,
Yes, absolutely.
and that's definitely was not on the radar when I
Yeah,
was a kid.
absolutely. Yeah. So
Yeah.
you've touched on, I think, what I up to now, talking more like it's, a condition that's been identified or diagnosed. But what about, yeah, stress, anxiety,
Mhm.
worry,
If we deal with
uncertainty?
those more early, it can
Absolutely.
prevent a slide downhill into these other
Yeah.
areas too,
And
right?
well, it would allow us to be more comfortable discussing that.
Mm-hmm.
Um, what I find so often, and this doesn't, I mean, I don't see it in my psychiatric practice, but I sort of see it in, kids and even within my family. You see somebody that it doesn't take a clinician to, and they're like, they're anxious, they're nervous, they don't feel as
Yeah.
well. There's been a change, like they seem quieter. What we tend to do as human beings, we shy away. It's not part of my business.
Yeah, that's
But
so
we should do
true.
the opposite.
Yeah.
We should say,
How are you?
Joe, I noticed that, the last few times I've met with you, I've seen you, you seem quieter. You're not intruding, you're just being a friend.
Mm-hmm.
I, I think we need to get closer
Mm.
than sort of be, it takes courage for me to
Yeah.
approach, but what you find, and I notice it myself, and I encourage it in my children, we have a responsibility, friends, family, neighbors. You notice something, because you end up getting more, that now you feel good about what you've done.
Yeah, yeah, that
Hmm.
interaction. I mean, we're a communal species, right?
We are.
I mean, healing in my mind
Yeah.
is not it's not an individual
Right,
thing. Like
right.
you can't heal by yourself.
Yeah,
We need each other.
yeah,
So having that understanding and having our communities are just I hate to use the word society as a whole, but
yeah,
us as a collective being more knowledgeable about
right,
these topics and being comfortable bringing them up.
yeah,
It feels like we could support people who are struggling better.
yeah, yeah.
Yeah.
I mean, and you hear all over, the media, are we getting more disconnected than connected? I mean, it's a whole different topic, but
Yeah, it's interesting because yeah, social media can do both.
yeah,
What are some of the solutions that you see? I mean, at the end of the day, it is that human to human kindness,
right, right,
in my mind.
yeah,
Which if we just say the power, there's such power in that,
yeah,
right?
right.
But we also need to look at systems too. We've got this mental
Work
health care workforce
shortage,
shortage,
right? Yeah.
and I've experienced having mental health challenges myself and talking to a primary care physician, and the difference between the ones that are like, oh, tell me more, and the ones that are like, start getting really
Yeah.
nervous, it
Right.
affects you,
Yeah.
So that's what the TNT program is all about, is putting
Right.
those tools into those frontline providers.
Mhm.
So tell me about your work with TNT and why it's so
Yeah.
important.
Right. I think you hit the nail on the head. It starts with, we do have a workforce shortage. We will never have, in my mind, enough mental health specialists for the number of people that could benefit from somebody that has some specialized kind of training. Um, and that's, I think, the basis of this, a program like the Train the New Trainers, is to help the frontline people that might have some pulse that some depression or anxiety may exist, support them in developing some tools to inquire, and then in an ideal situation, maybe even begin some treatment, some further evaluation, and follow that individual. Flip side, I think we have to be careful putting more on the primary care
Yeah,
doctor.
because they're so busy
They're
as it
so
is.
busy as they are. And so again, it's probably strange hearing it from a psychiatrist. I think mental health evaluation is easy. And you don't, I know,
Okay,
I
well,
knew it. That's
easy
why,
to you, right?
that's
Because
why
it's your
I gave, I
specialty.
forewarned.
Yeah, okay.
But you just have to be a
Yeah.
human being. It can be done by a medical assistant. It can be done by the receptionist in the office. It can be done by by your family. When you're noticing something, I think the beginning of treatment is somebody,
Seeing.
yeah, or somebody just pointing out what
Yeah.
they've noticed. That opens up the door to so many possibilities. That individual now becomes, that they're not by themselves in whatever they're experiencing. Somebody else has entered that world.
Mm-hmm.
So that could be, in high school, a friend,
Mm-hmm.
college. Uh, so I think if that was done more, that next step, if it now needs a more professional evaluation, you've somewhat already set the foundation that of some discussion, prior to that. I think that would go so far.
Yeah.
Um,
And a lot of my conversations with the TNT fellows, one of their favorite things that they've learned, and I
Yeah.
hear this over and over again, is the motivational interviewing.
right.
Yeah, they love it. I mean,
Yeah.
it gives them a framework for having
Ab-
these conversations that are so important.
Absolutely.
Yeah.
Absolutely. Um,
Maybe we could all learn it,
yeah. No. Well,
regardless of our field to a certain degree.
that was exactly where I do think we
Teaching
are.
in schools.
Yeah.
Yeah.
We know that it's changing. I can speak because I work at a medical school, but there's a lot of movement to change medical school curriculums where, instead of spending 8 weeks here or 8 weeks there, have a little bit more behavioral health
That would be
integrated
amazing.
earlier.
Yeah.
There are some schools that are doing this, because if you're an emergency room physician, you're seeing behavioral health.
Yeah.
If you're a pediatrician, you're seeing behavioral health.
It's all linked though, right?
Yes.
It is not separate.
No, so if they get some education early, the TNT program wouldn't like to hear this. We may not need the TNT program.
I was just thinking
we may
that.
not need
Well,
it.
we need them now.
We need them
Right
now. We need them
Okay.
now.
But
But even like physician assistant programs, it's a 2-year program. They only get 2 weeks of behavioral health. I mean,
Oh.
2 weeks. And it's not a full 2 weeks. It's a half a day in a clinic where they're just, they're checking off, I did my 2 weeks. I mean,
Hmm.
and they're going
Yeah.
to be seeing depression,
Yeah.
40% of the practice.
Yeah. It seems like a no-brainer though, because it's like if you have a health condition that's very
Yeah,
serious, it's going to affect your mental
right,
health. And if
right.
you have a mental health condition, you're probably going to get sick,
Yeah, yeah.
right?
Yeah,
It seems kind of obvious to me
right.
at this point that they're
Yeah,
connected.
right, right.
So I don't know, maybe just more conversation around this is
Yeah.
going to
Well,
help.
we have, we shouldn't just point to stigma in society. There's just as much stigma within the healthcare field toward
Mm.
mental health.
Oh, really? Still?
Yes. Yeah.
Oh, no.
Um, there's even stigma within
Psychiatry.
psychiatry
Oh, I'm sure.
toward people with chronic illnesses. Like, oh, I don't
Uh,
want to see people with chronic illnesses. That's not real psych. I want to see people that are like neurotic and, I mean,
I want to
you
pick
know,
my
you,
illness to see.
yeah, I
Okay,
mean,
yeah.
that's society needs people working with the most severely ill people for
Mm-hmm.
psychiatrists, not, I, and I'm going to end this like the worried well. I
I'm
mean,
worried. Well,
yeah, I mean, like,
yeah.
oh, I'm having this dispute or this problem. No, we need people working with chronic mental illness if you choose
Mm-hmm.
psychiatry as your profession.
Mm-hmm. Um, what do you think about ideas that support people in learning mental health skills earlier on in life? Things like self-care, for example. Like I've learned, as I've gotten older about self-care and being able to manage my emotions or my
Right.
moods, for example, just by understanding yourself and knowing what works to lift your
Yeah.
spirits, for example. It just seems like if we could teach people these things, then maybe it wouldn't have to go on the path
Yeah.
where they would need to go to a
Right.
psychiatrist.
Yeah.
Do you think there's something to that?
Absolutely. And what I was hearing also was teach them at an earlier age.
Yeah.
I heard that from what your question. Absolutely. And I think uh, elementary school students, certainly middle school, high school, they're probably would be more receptive and learn
Hmm.
these self skills much better than us as adults.
Yeah,
I
yeah.
think they would be able to absorb it
Hmm.
and appreciate it. Absolutely. I
Yeah.
mean, this has to be something introduced kindergarten, first grade, second grade, a regular part of the curriculum.
Yeah.
Um,
And then
yeah,
there's that movie Inside Out. Have you seen that?
I haven't,
Well,
but
yeah, but it's
I,
about there's
yeah,
different emotions
okay,
that take on characters in a person's brain,
yeah,
and there's anxiety and
right,
there's fear and all of like
yeah,
different and
right,
they talk to each other like the different
okay.
in the
Is it
child's
is it like
brain.
it's a child in the
Yeah, it's a
Inside Out?
child,
It's a
and
child, okay,
it's a child, and inside the child's brain is the six different emotions,
yeah,
and they're all doing different things at the
yeah,
same time according to what the child is doing. And I'm like,
yeah,
I just love that there's this movie for my kids
okay,
to watch,
yeah, okay,
So hopefully all of these kids learning earlier. I have a lot of hope, honestly. I
yeah,
tend to be an
oh yeah,
optimistic person, but
sure.
what is your view of the future in mental
I'm
health?
optimistic
Yeah.
too. I mean, sometimes you get a little dejected too that,
Yeah.
oh, why is that still happening? But as a whole, I ask myself the question, are we, better off as a society as far as mental health today versus 10 years ago? And now that I ask myself that
Yeah,
question, I'm
please
still
tell me.
reflecting.
You should know.
A part of me, I was going to say without any uncertainty, yes, we are. But I mean, we are. We
Okay, this
are.
could be a yes and no
Yes, yeah.
answer.
Or
Okay, in
would
some ways,
I would
yes.
hope we would have been further.
Okay, you wanted more
Yeah, I
progress.
wanted more.
Okay.
And I don't think it necessarily will be through like more research and laboratory work. I think it'll be the simple things we just talked about from the earliest age, keeping people connected. We're not going to change social media. We're not going to change artificial intelligence. That's
Catphone, yeah,
coming.
bad.
But with that, we'll do better with artificial intelligence and social media if we keep our connection there and not all operate in isolated boxes.
Mm-hmm.
Um,
Yeah.
it just doesn't seem like that's the right direction. And so I think that's something from an early age, you know, letting, young kids know the value. Let them, fully embrace that. Um, so that makes that you know, I do hope that, the people who decide on the direction of education and the direction of programs, use that as their foundation. Does this make us more connected or less connected with whatever idea they have?
Yeah, yeah. And then what else? What are some other solutions or ideas that you have
Yeah.
to help us? I mean, you've got a wealth of experience and
Yeah.
knowledge.
Yeah, particularly like for the chronic mental illnesses, we need to continue to support research and discovery. As I mentioned earlier, we're in my mind still at the infancy of understanding the brain, but I am a believer of not slowing down technology. I think discovery, the slope of discovery may be even faster than what it's been because so much is coming forward. Uh, so I think new medications will come forward. We'll get better at identifying earlier. We'll find ways to keep people on treatment and adherent to treatment so they can get back into a productive life. Uh, I think stigma will be less of a barrier. Um, so yeah, I think we're more accepting of mental distress, mental illness today than 20, 30 years ago.
And then what is your vision for the TNT program?
Yeah. No, you know, the success it's had in its 10 years up to this point, uh, I, and its growth, and now that there's actual outcomes that they're measuring, which I think is important.
Yes.
I think the concept, most people say, oh yeah, that helped. But, we need data. Do the people who finish that program, are they enjoying medicine more?
I love that you're studying that.
Yeah, we're studying that.
Yeah.
Because it's great to have an idea but is that person like more, bringing, is more satisfied with because so many people are burned out in healthcare. But is this group who goes through this program more like excited about why they went into healthcare? They want to, I hope they are even more excited when they leave a program like this.
I think they are.
Yeah.
The ones I talked to.
The ones you, yeah. But let's
They're
actually
very
look at the data
enthusiastic,
versus people who haven't.
Yeah.
Are they, and this is, I think, one of the key features of the TNT program. It's a little harder to measure, but when they go back to their clinics, are they now teaching the people they work in? Are they, it's trained
Ones
new
that
trainers?
I've talked to are definitely.
They are, okay. Then
Yes.
you have a better pulse of that. So
they become like the go-to person.
the go-to person,
Yeah. That they say, oh, you took this class. What did you learn about this? Because they're always talking, right?
Like, oh, I know you went to that program.
Yeah.
Like, okay, here's a patient, and I'm pretty sure that person would give them some guidance.
Yeah.
Imagine that, like, but then at the same time, we have to support that person who's completed training.
Yes.
Do we support them financially? Do we support them? Does that health, group, do they get a little bump up in their salary? We have, because now to take on that role of being, a trainer for that clinic or that health system on top of all of your work. So I think a lot, the administrators of those clinics or those health systems have to appreciate who's completed the training and support them and give them maybe some free, identified time where they can actually do some supervision and so forth.
Yeah, that would be really great.
Yeah.
Well, I'm just excited to see all the work that TNT is doing and meet so many incredible solution seekers through this program.
Right.
So thanks so much for sharing your wealth of expertise and your ideas and
Okay.
Great.
Yeah,
Thank you so much.
Thanks for your support
Yeah.
for the program and getting the word out.
Yeah, wonderful.
Yeah.